guy.
Everyone like to be seated, please? We'll wait till everybody gets a seat.
More interested in the ladies. Oh shoot. Yeah.
It's my honor to welcome everyone
What the heck is wrong with the Zoom?
to
Come on.
IGT Tech, Breckenridge School of Nursing. First pinning ceremony. About 3 years ago, I went to a meeting, and someone said to me, "We're going to start nursing." And everybody said, "Oh, that's too big a headache. That's a lot of work. You don't want that." And I said, "Yes, I want nursing at IGT Tech in Canton." And the floodgates opened, and this group of students came in the door. First orientation was here, wasn't it? In these rooms. And here we are, 2.5 years later. It's a wonderful thing. And I'd like to welcome all of our guests and family to enjoy this pinning ceremony with our staff and our students. And I look forward to seeing all of you also at graduation on Sunday. Karen.
Good afternoon. My name is Terry Wheeler. I'm the nursing program chair. And first thing I'd like to say is good afternoon. And I would like to start off by just kind of giving you a little history about nursing. And I'm going to start with the job description from 1887. And it included the nursing duties as daily sweep and mop the floors of the ward, dust the patient's furniture and window sills, maintain an even temperature in your ward by bringing in a scuttle of coal for the day's business. Light is important to observe the patient's condition. Therefore, each day, fill the kerosene lamps, clean the chimneys, trim the wicks, and wash the windows once a week. Now, I know that makes us laugh, but let me share with you where that came from. And in order to do that, I need to start with Florence Nightingale. Florence Nightingale was born in 1820. She was English, and she would become a nurse. She would become famous because of the care that she provided soldiers during the Crimean War. The conditions for the wounded were deplorable, and many soldiers died from contagious diseases and from infections from their wounds. When Florence arrived at the Barrack Hospital, she described these conditions. There were no vessels for water or utensils of any kind, no soap, towels, or clothes, no hospital clothes, the men lying in their own uniforms, stiff with gore and covered with vermin. We have not seen a drop of milk, and the bread is extremely sour. The butter is most filthy and in a state of decomposition, and the meat is more like moist leather than food. Nightingale quickly established a vast kitchen and a laundry. She was on her feet for 20 hours a day, and her nurses were also overworked. She was the only nurse allowed at night when the other nurses were replaced by orderlies. The wounded men called her the Lady of the Lamp. She would go on to establish the first nursing school in England, honored as the founder of professional nursing, introduced principles of asepsis and infection control, a system for transcribing doctor's orders, and a system to maintain patient records. Because of these efforts, there was a decrease in the death rate of the soldiers from 42% to 2%. So let's fast forward to the 21st century. And here are the duties that nurses perform today. They perform physical exams and health histories. They provide health promotion, counseling, and education. They administer medication and wound care. They interpret patient information and make critical decisions about needed actions. The modern-day nurse's responsibilities have broadened, but it is still ultimately the nurse's responsibility to ensure that the environment is conducive to healing. Earlier in this century, in the 21st century, this campus opens its doors. In September 2009, the first nursing class was admitted, and a journey began with a group of 30 nursing students. And this was not just any group of nursing students. They were pioneers for the nursing program at ITT Technical Institute, which would ultimately become the Breckenridge School of Nursing at ITT Tech in Canton. The journey was for these students to be educated to become registered nurses. This was not an easy feat, and this was not for the faint of heart. For to become a member of this profession called nursing requires intelligence, an independent thinker and spirit. You must be able to function independently and be a critical thinker. Today, 21 graduate nurses are going to be paired. I would like to share with you some information about this class. Our nursing students start their clinical in the fourth quarter. Almost immediately, positive comments started coming back to campus after this class started their clinical about how good the nursing students were. They were compassionate, how they seemed to have knowledge about more skills than other nursing students. They were even compared with baccalaureate degree nursing students, and guess what? They won. As they moved through the program, the positive comments followed them. They were helpful, they were attentive, and they were knowledgeable and caring. I watched them grow, mature, and yes, develop those critical thinking skills that I and other nursing faculty spoke so much about. Many times, I went into their classroom to give them pep talks or a gentle nudge. Okay, really, I went in there with my invitation of a Marine sergeant. Pushing them, challenging them, and stretching them outside of their comfort zone. I had no other choice once they started this journey. There are no shortcuts, no mediocre, no half-stepping when it came to becoming not just a nurse, but a good nurse. You rose to the challenge, and you succeeded. You can look your family, your friends, your coworkers in the eye and say, I did it. Make this your first step, and what a great first step it is. But also remember that you are never done with learning when it comes to providing quality patient care. Remember that no one expects you to know everything. If you do not know something, ask someone or look it up. I'm going to leave you with a virtual chest. Everything that you need is in this chest. Just reach inside and get it. Don't worry, you'll never run out. It contains 4 items. The first item, faith. Have faith in yourself. You are the nurse. 2, have faith in your peers. All you have to do is ask for help, and someone will be willing to assist you. Have faith in whatever stream you draw your water from. Have courage. You earned it. Once you pass the NCLEX, you will be their equal, even if you are a new graduate. And yes, there will be a learning curve, and it will take time. But this period does not define the nurse that you will grow to be. And do not let anybody tell you differently. Then pull out your critical thinking skull cap. A skull cap is knitted, and when it's new, it fits tightly around your head. But the more times you put it on, it will stretch until it fits perfectly. And then pull out a virtual recorder. When you turn it on, you'll hear my voice saying to you what I told you on that first day of orientation. Say to yourself that nothing, no one, no circumstance is going to stop me, which is you, from achieving my dream, my vision of becoming a registered nurse. And with that, we're going to start the pinning ceremony. I'm going to ask Regina Fuller to come up. Renita Anderson.